I cover a lot of stories, and while I'm often told in the comment sections of most of my stories how tucking my dick will never make me a woman, there are real women who exist in this world who actively give birth all the time. And what we never talk about is the outcomes of pregnancies, childbirth, and the complications around the delivery for Black women. Black women Black women are 3 times more likely to die in childbirth than white counterparts. Did you know that? For all the stuff that's going on in the world about the Strait of Hormuz and price of oil and all this other shit, the thing that's most pressing to me personally, as an African American, as someone who actively engages with biological women, to say nothing of trans men who also give birth, which we should say birthing individuals. Black people, regardless of their class, you could have all the money in the world. They are still 53% more likely to die than everybody else, regardless of your race. And that's from an 11-year study. 11 years! That's a long time. That's a couple presidents. Maybe 3 even. 11 years. Long time. And why is that? And here's another fact. 84% of all maternal deaths for these Black women are preventable. It's not like Black people have some certain Negroid situation that makes them more likely to die in childbirth. It's that Black people specifically are mistreated in the healthcare system. 30% of Black women report that they were denied and overruled when they wanted to have their own input in their own children. When someone's growing in their body, they are the carriers of life. All this talk about Trump and the Pope and religion and civilization, women bring life into this world. They create life and they foster it physically within them. It sucks so much resources out of them and they create that. We need women to be healthy. And when it comes time for them to get to the hospital, our health system fails them. This is not a 2026 story, okay? This has been a thing since 2023, since 2019, since the 1980s, going back. I mean, we started as slaves. And you can be sure that they cared a lot about making sure those kids were born back then. It's a major issue. As we head off of Black Maternal Health Week, which was last week in April, and we are currently in the middle of National Infertility Week, which goes after all the people who did not make it, all the souls who were stillborn. We should talk about this. For all the people who talk about abortion, about 61% of Black women live in states that have recently banned abortion or are about to. And you know that when you close Planned Parenthood, they don't just do abortions. They plan your fucking parenthood. They help mothers who do want their children to get through. There's not enough support for that. There's not enough support for doulas. There's not enough support for midwives. There's not enough money for that. Not enough resources within the community. There are 2 bills that could potentially go through Congress that have already been made. Okay, let me get into those, actually, baby. Black maternal health is resilience, resistance, and joy. Okay, Congress must pass the Black Maternal Health Momnibus Act, cute, and also the Care for Moms Act. Both of those offer more resources, whether it comes to extending Medicaid coverage, bringing more resources to underserved and remote areas, like in these big red states, for example. More training, the community services themselves. We could have training from the doctor, bringing it to the doulas, to the midwives, to these OBGYNs, bringing it training on down to bring power back, hiring more people, diversifying, diversity, equity, inclusion. And the thing on that is, there are more rates of hemorrhage. That's when women are bleeding out. Bleeding out is about 27% of all maternal deaths. Black women, and a lot of that is through C-sections, but 1 in 3 Black women, they have the highest rate of C-sections than anybody else. And that includes low-risk situations in which you don't need that. They have a higher risk of preeclampsia, which gives Black women seizures. A higher risk of hypertension, which is high blood pressure, which affects the development of the baby, if not the delivery. It affects a lot of things. And again, these are preventable. This is not a medical thing that is inherent to being Black. Through the neglect, through the ignoring, through not taking Black people seriously. Doctors who are not necessarily familiar with Black people. As Gen Z becomes moms, these issues continue, and these issues continue after the birth as well. About 1 in 5 women have mental health struggles, and that is double for Black women. About 2 out of 5. That's 40%. That's nearly half. Okay? And not only do they have issues with mood disorders and anxiety and depression, they also get lower quality medical care too. compared to their white counterparts. And that is not just because of an insurance issue, although I should say that about 89%, only 89%, that's about 11% of black moms are going without, compared to only 7% of white moms, non-Hispanic white moms. It's about the lack of access, the lack of logistical resources, the stigma, because it's not exactly a level of care that people really receive because they don't have those resources, and the lack of community appropriate things. We could have more federal funding for that. We could have more programs that track and keep awareness of this issue and address these issues on a state by state level. Like, this doesn't have to be a thing. We have the solutions. 2 bills already in the Senate and in the House, a version of each bill in those respective houses. There are ways to go about this, and it's not happening. Both of those can be passed, and it needs to. It's a major issue, and whatever I can do to bring this to you, as I bring the news to you, I'm happy to. I don't get that many viewers. I don't have a lot of subscribers. I don't have this massive platform, just like this issue doesn't. If you like my content, if you think I had something important to say, if you learned some shit, share this. Spread awareness of this issue.